Hey y'all. Um Tonight I wanted to hop on here. I'll actually probably upload this video tomorrow, which will actually be today for you all. It'll be on Tuesday. Um but before I was trying to rest tonight, I was thinking that I would get on here and speak about panic disorder and panic attacks. Now, we've all had times in our life where we get a little anxious, a little nervous, but for people that have panic disorder, when they feel very stressed, or a lot of things have come to um, a halt in their mind, it's just too much going on up there, they will have what's called a panic attack. And online, I'm going to read you the online description for this. A panic attack is a sudden, intense episode of overwhelming fear or discomfort that triggers severe physical symptoms. Now, remember that word I'm going to highlight, severe physical symptoms. For those that struggle with panic disorder and panic attacks, they will often feel like you're having a heart attack. You will feel when you have the first one like you are dying. That is what I felt like. It came out of nowhere. I remember when it first happened to me, I was I would have been about 19, 20 years old. I'm 41, guys. It was a long time ago. It feels like now. But anyway, I just had my baby, first baby. Had stayed up all night with it, as you do. And I remember just being so tired. I was going to college at the time, making straight A's. I was working my tail off, taking care of my child, my house, my husband that would go in really early for work. He'd work about 60-hour shifts. I was juggling a lot. As you all know, how anything in life is, every day is a lot sometimes. But anyway, for my young mind and body, I was very tired, and because I think of because of my genetics and things of that sort too, I think that I started suffering from just some really going in there, just a lot, right? So what would be a little stress to someone else was a lot of stress to me. And so, yes, I started getting short of breath. I remember my hands being really sweaty this evening that this happened, or I think it was in the morning time. I'm sorry, it's been a while. This is unfiltered. I'm just going with this to tell y'all the first time I encountered one of these attacks. And also, let me back up a little bit. About a month into our marriage, my husband had lost his dad. And keep in mind, we were just only about 19 years old at that time. So that was a traumatic experience, and we didn't know it was coming. His dad just had a sudden heart attack, massive heart attack, and died. So that was a lot on us, a young couple. We were working on a home. We didn't just have one that was already put together all pretty. We were working on it, getting it out, fixing it up. So we were also doing that in between his working 60 hours a week, me going to college, and as people do, just juggling a lot, and with a newborn baby. So yeah, but this morning I actually went to the ER because I didn't know what was happening to me. And the real fact of the matter is I was just exhausted. My little brain and body just couldn't handle no more at the moment. So there came along a panic attack. Now, what made this a panic disorder is I started having more panic attacks. And I'm talking about they were lingering every single day. Not a day ever so often, every single day. I mean, they can't really tell you why other than genetics, chronic stress, hormone changes, different things. And my pulse rate during this time would get so high that the doctors and nurses basically told me if I didn't get on some medication and get some help, I was going to fall off my feet. And I mean, like, literally fall off my feet, if you get my drift. So I started getting tachycardia, which is kind of like, it feels like a skipping of the beat. Your heart's just pounding. It was awful, folks. I would go weeks with just felt like no sleep. I literally went about 3 days with no sleep. I'm talking not the first week. I was in a fog. I thought I was going to die. I will reiterate that. Yes, and it's no laughing matter. You know, for years, this has separated me from my friends, a lot of my family, because I couldn't make anybody understand. You know, a lot of them would be like, well, you know, I've had panic attacks too. Yeah, but did you have them every day? Um, did you have to quit college over it? Did you have to quit your job over it? Did you have to quit things over it? And I did. And so many people do. We need compassion for people. If I sound like I kind of got a little bit of a chip on my shoulder, I kind of do. I'm trying to find grace all these years and extend it to the people that don't understand. But, you know, people that have been through so much, you know, we need a little empathy and a little more empathy in the world. We really, really do. Everyone is so caught up in their own lives a lot of times that they just don't want to put themselves in someone else's shoes. And again, my big O thing on this platform is going to be educate. Educate, educate, educate. Get online. It's right at your fingertips anymore. I know everybody's just about it online these days. If you have someone struggling with what they got diagnosed as a panic disorder or a mental illness like depression, bipolar, PTSD, please do your homework and educate. Like a video I'd mentioned in before, if you don't educate yourselves, you can't help that other person. And let me tell you something, don't blame yourselves though, okay, for not being able to fix the other person you're trying to help. Sometimes this is not quite so easy to be fixed, per se. People need to be on medication sometimes, not over-medicate. I'm going to preach that, not over-medicate. Getting the right amount of medicine and a good doctor, keep looking till you find them, a good doctor that can help with this, folks. And I'm talking about the panic disorder that interrupts your daily life. You can't go on about your daily life and function like you used to, okay? And that's what I had, okay? It wasn't just one spur of the moment, then I could go on. And it didn't matter how much I fought it and how much I tried. I couldn't stand myself in my own skin. I remember being in college, and again, keep in mind, I was a straight A student, okay? Keep that in mind, okay? So obviously I wasn't lazy and I was trying. I had a 4.0 while juggling a baby, a marriage, a husband, sick family members, this and that, okay? But I still, and I was being sociable. I was doing I call it the American dream of what everybody's doing, fixing the house, all that. But it still happened to me, folks. You can be the most successful, smartest person in the world, and boom, a mental condition or illness, I like to call it, will come in. It's not your fault. It is not your decision. Please know that. Even if others around you make you feel that way, please know that. It's not your fault. You didn't ask for this. But there is help out there. That, you know, there's medication, there's therapy. Like I said, don't over-medicate. But there's therapy. There is helping yourself, you know, exercise if you can. Not over-exercise. Just, you know, exercise. Make sure you're eating good, resting good. For people that have anxiety, that is very hard. Today, I haven't ate that good. Nerves, it's hard. I don't sleep very good. I'm an insomniac. Gosh. And I've been this way, y'all, since I was like 2 years old. It doesn't matter how tired I am. Like I said before in other videos, there is some tired that you just cannot fix. But yeah, there's a little emotion in this video because I was just thinking, it's so hard to explain to people out in the world. And I really wish people would have compassion about this. It is such a big thing. It's such a silent thing. Nobody wants to speak about it or talk about it. And we're doing a lot better today than we used 2 years ago. Don't get me wrong, okay? But we really need to be compassionate about this, because what it is that if somebody else is not fitting the grid of what your normal person is, if they can't go out to this party, if they can't show up at this gathering, then they're made to be a pariah and the black sheep, right? Well, sometimes it is harder, folks, for another person. And if that person you knew could have done that a long time ago and they can't now, they're obviously hurting and there's something going on there. So you need to help them. Help find them support. If you can't just fix it for them, the best way is to educate yourself, to educate them. And then get them to a doctor. It's a serious thing. I was told this at an ER in a hospital setting. This is not something that I pulled out of my rear. I had this, okay? Now, a lot of people can do better than other people, okay? This is like anything else. Certain people have certain levels of diabetes. Certain people have certain levels of this, that, and other. You all get what I'm saying, okay? Um, different ways to treat different illnesses and this and that. Same way with this. It's going to be different for everybody, okay? But it can be genetic. It can be brought on by hormone changes, genetic chronic stress, different physical factors. Check y'all's blood, check y'all's hormone levels and things like that, okay? Ask your doctor. But yeah, I wanted to give you kind of like I said, my heart was palpitating, felt like out of my chest. I couldn't rest. I just couldn't think straight. It was like I was higher than a kite, as one can say. I mean, it was like I was in a fog. I had never felt anything like this before. It was very scary, y'all. It was very hellish. Wouldn't wish it on my worst enemy. And it just hit me. Like I said, I had a little bit of something going on. I felt like senior year of my high school. When I got up and done a speech one time, and I felt kind of off. Like more off than what you should feel. Even much more than butterflies. You know what I'm saying? And I used to sing on stage, guys, okay? I was the first one on the dance floor. It just happens sometimes. And I think it's because what I have studied and I've seen in my own family and stuff. Genetics, like I said, can play a big factor in this. Is it seems to peak at about 18, 19 years old of what I've noticed and what I've read and studied. And this is a proven fact, scientific fact. And I think it's because of fluctuations of the hormones. That's what I've read. And it hits people around this age. Early 20s are people that, and we got a lot going on in early 20s, especially this day and age. If you're going to college, you're juggling work. Some kids are trying to start families early. It's a lot of stresses, especially this day and age when we're coddle our kids more and stuff. And that's okay. I mean, we love our children and everything, but every generation is trying to make it easier, easier, easier. And even in the Bible, it says we will grow wiser but weaker. Our bodies sometimes can't handle, and our minds can't handle so many social pressures and stress just through at us, right? So I think that's what happened to me. I also dealt with a lot of sickness and death in my family growing up. My parents were never in good shape. My friends and people that I grew up with, I know had to know that. We were in the hospital about all the time. My dad had what they call a widowmaker when I was about 19, 20, about took him out. He had constant surgeries over the years, trying to prevent blood clots and so on. My mom would have passing out episodes all the time since I was like 5 years old. Scared me to death. I think that was a lot of trauma. Because when she passed out cold, y'all. It was a different kind of passing out I'd ever seen. And I think she had like her vagus nerve and stuff. I think she had a lot of stress and things that took a form of that. They never could figure out why she was doing that. And they constantly ran tests on her. She also had cancer twice, and that's what took her out, bless her heart, again. And my husband had a cancer diagnosis, thank God. He is doing well now. My kids have had a lot of problems. I lost a child at 2 weeks old back in 2009. Tomorrow, will be today, maybe when y'all see this. I might upload it tonight, I don't know, but on the 9th is his birthday. So, yes, I lost my sister, my dad, and my mother by 40 years old. So, and all my grandparents, all my aunts and uncles. I got one aunt by marriage. So how many people can say that about this age? Some people have lost a lot more. Some people have nobody. And my heart is all out there for you all. But I'm just saying that's a lot on one human. And a lot of people wonder why certain people can't do this, do that, be there with them. Listen, we have a hard enough time breathing in and out and stepping one foot in front of the other, y'all. We just do. And everyone has their trials and tribulations. And Lord of mercy, I know that. But we really need to have compassion toward people that have mental health conditions. And when you say mental health conditions, it just makes it so taboo. Don't it feel like that when you say it? I wish there was another name we could call it, but I'm really trying to hit home too of how serious this is. because it really was interfering with my daily life. It still does. I'm a lot better than I used to be, y'all. But it still does. I still have social anxiety. Now, this is coming from a person that sung live on a stage in front of thousands of people, okay? Keep this in mind. It just hit me. It is something chemically, physically that just happens to people, okay? It's nothing we can help or choose. And, you know, if we're going to be friends with people or family with people, we have to really understand this and give these people room to breathe, but still check on them, still love them, support them. And again, please educate yourself. That way you know why this person's more irritable about this little thing, that to use a little thing, you know, or why this person is this or that or acting this and that way. Educate yourselves and you'll know. Just do it. Please. It'll make it so much more better on the people that struggle, so we're not having to sit there and defend ourselves and over-explain. It is so exhausting, guys, and we're already exhausted. So you want to know the best thing you can do for us is educate yourselves and give us grace. We can give you all grace if you give us grace. And like I said, this is raw and unfiltered. And I try to be very softy about all this stuff, but it does get on my nerves a little bit that there's not more compassion for people and more empathy for people. And I'm one of the most empathetic people you will probably meet. But sometimes I don't have much tolerance over when people are treating other people wrongly. And it is wrong, and it's abuse to other people to dog them because they couldn't show up or do something because maybe you can. Well, you know what? That's wonderful and lucky. But for some people, we have a little harder time. So give us some grace and educate yourselves. This video has been about panic attacks and panic disorder. Stay tuned, and I'll okay, and let me tell you too, like I said, you're probably wondering, well, what do we do about that? Again, I want to reiterate. Sometimes therapy, sometimes just it's going to just take time to get a little better. But really, let me tell you what has worked for me and everyone that has it this severe is you're going to have to probably get on medication. I hate to say it. I fought it and fought it. I don't even like taking Tylenol. But it did help me, y'all. Why? That's what's showing it's physical and it's not in our head, but it's literally in our brain, like an organ in our body. And look at my hair. Woo-woo. Look like a rooster. But it's in our head, brain, in that way. It's physically there. And we have to fix it with something. It's a serotonin level. There's different things like chemicals and things in our mind that we might have to put a little more into a certain particular person. Like anything, right? It's just biology. It's so yeah. So do your research. Love the people. Love them up. Because they love you so much. The people that have anxiety are some of the sweetest people that you could ever meet. Wear their heart on their shoulders, are full of so much stress, are trying to take on everybody's problems around them, are exhausted, or tired, are having a time just living from one day to the next. So please have compassion, you all. Spread the message. I was just wanting to get it out there of what panic attacks were. That way, if you are having one or someone that you know is, please just get them to the doctor. Have them checked to make sure nothing else is going on. And, yeah, just get some help, y'all. It's out there. And it's a common thing. It really is. That's why I don't understand why it's so taboo and why we're so ashamed of it. It's like anything else, y'all. There's nothing wrong with us or broken with us. It's just something medical like anything else. Diabetes, anything, any condition you can think of. This is just one of them. So, yeah, I love y'all. And that's a little bit about panic disorder. I may speak some more on it later. But, yeah. So spread the word, please. Follow. Thank you all so much for taking the time. I know this is a long video, but it was important and laid on my heart. So love y'all. Drop in the comments if your family struggles with this. My heart goes out, and I'll be praying for you all. And yeah, I'll talk with you soon. God bless.